The rapid eye movement actually loosened the tape on both of his eyelids, and it created a tiny slit that he could actually look through. And what he saw terrified him. The surgeon was walking over next to him. He was getting his gloves on, and then the surgeon says, "Scalpel." And the nurse hands him this chrome metallic blade, and the surgeon takes the blade and begins cutting into Sherman's midsection. Sherman felt everything, but Sherman couldn't do anything about it. All he could do was rapidly flick his eyes left and right in hopes one of them would see that he was awake, that he was feeling this. But no one was paying attention to his face, so they didn't see his eyes moving around. And so the surgeon continued to cut into his midsection until he had cut out a fairly significantly sized hole, at which point the surgeon hands the scalpel to the nurse and says, "Clamps," at which point the nurse hands him what looks like a torture device, and the surgeon proceeds to use these clamps to pin segments of Sherman's skin that has just been cut open to his body to basically keep the hole open. And then the surgeon began tugging on the outsides of this hole in Sherman's midsection, making sure it was big enough that he could actually get a good look into his body. And every little tug is sending lightning bolts of pain into Sherman's body. But again, all he can do is flick his eyes left and right, and no one's paying attention.